Early pregnancy. When you first find out that you're pregnant, you may or may not have had some symptoms. You may find that you're very tired, that you feel sick, which is not always in the mornings, it may be at any time of the day. You may find that you have to pass urine more often. You may have tender breasts or feel bloated, or you may not have any symptoms at all. So who do you go to see when you first get pregnant, and how is your care going to be organised? Your first point of contact will probably be your GP, who will usually refer you to the midwife attached to the surgery or your local children's centre for your booking appointment. This appointment is where a full history is taken from you about your health, any previous babies that you may have had, and to consider any potential risk factors that you may have for this pregnancy. You'll be advised on general health in pregnancy, diet, exercise, how to deal with any symptoms, the plan of care for your pregnancy, and given information on whether there are any antenatal classes that you could attend. Antenatal classes are generally offered just to first-time mothers, sometimes second-time. Some will involve your partner going with you and some not. The normal situation in the NHS is that you will have midwife-led or shared care if you're considered to be low risk. That means you'll see your midwife for most of your appointments. You may see your GP for some of them, and if you develop any problems during pregnancy or if you have any risk factors, then you'll be referred to see a consultant obstetrician at your local hospital. Some women do develop complications in pregnancy, which means that they need to have a little bit more care or be monitored more carefully. These may be problems to do with the mother, such as raised blood pressure, or there may be mothers who have pre-existing medical conditions, problems with their heart or epilepsy, problems with their thyroid. There are all sorts of things that may need a little bit more care. This usually means that during pregnancy, you'll be seen more often, usually by a doctor at the hospital. You may have all of your visits there if you have a lot of risks in pregnancy, or you may have just a few more than you normally would. If you have quite rare complications or something that's quite difficult to manage, it may be that you'll be referred to a specialist centre for that kind of condition in pregnancy, so your visits may not be at your local hospital. Sometimes with conditions like perhaps diabetes, you may have your visits with what is called a multidisciplinary team. That means not only an obstetrician will be present, but someone who is a specialist in looking after someone with diabetes as well. There are several of these multidisciplinary teams, depending on what the problem is during pregnancy, but that means that you see the right people all in the same place so that a plan can be made for your care during pregnancy and your baby's birth. There are a lot of things to think about in early pregnancy regarding your diet and lifestyle. If you smoke, you need to think about stopping smoking, as it's one of the most important things that you can do to improve the health of yourself and your baby. There are no clear guidelines as to whether it's safe to drink alcohol in pregnancy. You need advice on that, and also to make sure that you are eating food that is safe and nutritious. One of the most important things for women during pregnancy is having a strong relationship with the person that will be looking after you during pregnancy. This will normally be your midwife. In the NHS system, it can be difficult to develop this because you may find that you see a different midwife for a lot of your appointments, and in the beginning of pregnancy, you don't actually see anyone very often. In the NHS, you may see someone at around 12 weeks and then not again until 20 weeks, so there are quite big gaps, particularly at the beginning of pregnancy, and so you don't have anyone to talk to about your worries. Another decision that you'll need to make during the early weeks of pregnancy is where you're going to have your baby. Are you going to have your baby at home, in a birthing centre, or in a hospital? That decision will be affected by whether you have any risk factors, whether it's your first baby, and what's available in your area in terms of facilities. That's one of the things you'll discuss with the midwife at your booking appointment and at later appointments during your pregnancy. One of the most important things you'll have to think about in early pregnancy is whether you're going to have any screening tests. By screening tests, we mean whether you're going to have any testing for Down syndrome and other potential major abnormalities in your baby. We also include in screening tests the blood tests that are offered to pregnant women to look for any infections that may cause a problem for you or the baby during pregnancy, whether you have immunity to germ and measles, what your blood group is, whether you have a normal blood sugar, and your general health.